Welcome back to San Diego, people. Skin cancer is the most preventable type of cancer, but there are a lot of myths out there about the best ways to keep yourself safe. Joining us now to sort it all out is Dr. Hugh Greenway of the Scripps Clinic and Dr. Melanie Palm, who has a dermatology practice in Solana Beach. Thank you both for being here. So let's talk about some myths maybe that you've heard that you would love to dispel. One of which being, I know, is, you need to build a base tan, and a tanning bed is a great way to do it, so you don't get sunburn, because that sunburn will give you cancer, but the tanning bed's okay. Not true.
Not true. When we were kids, we would be sent out in the summer to get the first sunburn because you would get a tan, and this was supposed to protect you. We know that that's not true. We also had tanning beds, and these have been around for a long time. They do cause a lot of damage to your skin, not only contributing to skin cancer, but they can make your skin look older than it really is, sort of like an old baseball glove. Fortunately, with the American Academy of Dermatologists and individual dermatologists working together, we've had a number of states where we've outlawed these for minors, for teenagers and younger people, and that's true in California and others. So we've made a lot of progress. So getting that first sunburn is a myth. You don't do that.
Yeah, I often tell patients that if you have a tan, and I'm not an extremist. Yes, I do kind of practice what I preach, but I know that we live in San Diego, and I just want you to be sun safe. But I tell patients and explain to them that a tan is actually a sign of DNA damage. That's actually your body forming a protective coloration against damage to the nucleus, the brain of our skin cells and other cells. And so you just really want to be careful about that. And I talk to patients a lot about the ingredients that are in sunscreen, because I think that there is a big difference. As Dr. Greenway so rightly mentioned in an earlier segment, you want broad coverage and you want an SPF of 30. I really talk to patients about some of the great mineral-based sunscreens that are actually available. Zinc or titanium. You really want to look at those active ingredients. And I deal a lot with pigmentation issues too. And the way sunscreens work is different. So physical blockers reflect light back into the environment. Chemical sunscreens, the ones that you can't pronounce on the back of the bottle, those are ones that change light into heat energy. And so that can promote inflammation. You may feel warm on your skin after application. And so I have a tendency to steer more towards the physical blockers rather than those chemical sunscreens, because I think they can play a role in pigmentation and inflammation of the skin down the road.
Unfortunately, women, can use mineral makeup a lot of times and have a built-in sunscreen, which is great for us. And Dr. Greenway, I wanted to talk also about the Mohs surgery, which is more of a treatment, but it's a newer way and a new way to protect as much healthy tissue as possible.
There are a number of ways we treat skin cancer. There's no one technique that applies to all different skin cancers. But for certain ones, you can do certain things. And one of the more common now than it used to be, surgical techniques, is a technique called the Mohs technique, where we take the tumor out in a small area around it, sort of like a pie crust around a pie, and check those edges very carefully, which allows us to have a smaller amount removed, but also a higher cure rate. So it's one of the techniques that we use, along with a number of others here in San Diego and throughout the country and world.
And you can actually look at the skin that you're taking off right there
in the laboratory. I have a laboratory adjacent to my office, and so we can do it while you wait, basically, yes. And I tell my patients that's one of the advantages that we have in our office.
Yeah. Dr. Palm, I know you have an important event coming up, which is great for awareness and getting the information out there. I know you mentioned earlier May, obviously, Melanoma Awareness Month.
It's actually the 5th year we're doing this. I put on an event called Soul Search, which last year we raised $20,000 for the Skin Cancer Foundation. And so on May 2nd, from 9 to 1, we are doing free skin cancer screenings at my practice at Art of Skin MD in Solana Beach. There's 5 of us dermatologists that are going to be volunteering our time. Last year we found a melanoma, several basal cells, a squamous cell carcinoma, and lots of unusual moles. So we really encourage people to call. It's 858-792-7546 to schedule an appointment for that day. And then after that, on May 7th, we're actually having a party that all of the proceeds go to the Skin Cancer Foundation. It's from 5:30 to 8. That's the actual Soul Search event. We have live music. It's completely catered. We have lots of fun appetizers and drinks. We have a silent auction, and we're really hoping, we had about 200 people in attendance this year. We're hoping to double that. So we really want people to come out. You can buy tickets on our website at artofskinmd.com.
Okay, we'll have all that information on our website as well so that people can be aware of that. But it's so important to have your skin checked and screened, as we had mentioned earlier. Are there any other myths? I know we had talked a little bit about that. Are there any other myths out there that you hear sometimes?
One of the myths is if I have darker skin, I don't have to worry about things like melanoma and things. So, and that's not really true. Your incidence or your risk will be less, but it may be more of a problem because it won't show up early. So at Scripps, I tell my patients that have darker skin, yes, you're less likely to get something, but because the darker color of your skin, it may not show up as early. So we do have to pay attention to that.
Mm-hmm. And also, well, I need to get my vitamin D, so I should be out there for a while without any sun protection.
Yeah, and I think almost every dermatologist I think you talk to, we want you to get your vitamin D. There's so many advantages in terms of heart health and bone health with vitamin D, and we know that from studies, but we would much rather get you to have it the safe way, which is through diet and supplementation and not by sitting out. Actually, the amount of natural sunshine that you need to get adequate vitamin D produced from sunshine through your skin is only about 10 to 15 minutes, 2 to 3 times a week, just exposure to your head and a little bit of your arms. So that's not a lot. That's walking to your car on your commute. So there's no need to sit outside, and that's a poor excuse for getting a tan.
Yeah. Have you noticed anything changing industry-wide? I know you had mentioned some of the regulations with tanning beds for young people, which I wish had been around when I was unfortunately going to tanning beds and making that mistake. But are there any other things that you think industry-wide action to be taken?
The FDA, or the Food and Drug Administration, here in America is much more aware of the need for us. In fact, the Surgeon General has declared that we do need to be able to have the availability of new sunscreens. Perhaps in Europe they have some advances that we have not received yet, and I think that we're spending a lot more time and research and money to get those approved. We want to make sure they're safe and that they're effective. There's a new report out that perhaps one or two of the ones they're there, but you want these things to be safe to all of us, and you also want them to work. I have a number of patients that have sensitive skin, and I tell them, get the sunscreen that's made for babies and infants. If you look on the bottle, if your skin is more sensitive, then think about it. A baby's skin, a child's skin is more sensitive. You might want to use those.
Absolutely. Well, some great advice. Thank you both for being here and helping raise awareness, and hopefully we can send more people to get checked. And Dr. Palm, we will have that information on our website for your May 2nd and May 7th event. So thank you for doing that. Thank you both for being here. Appreciate it. That will do it for this edition of San Diego People. Join us tonight for the KUSI News at 6, 10, and 11. We'll see you then.
Great.